The rhythm sounds irregular. The horse is lamer on the left hind limb. However, unusually, the hindquarters drift to the left, towards the lame limb. The horse very carefully, as it decelerates from trot to walk, and watch the height and placement of each hind limb. There was a rather bouncy movement behind and abnormal elevation of the left hind limb before the foot was placed to the ground. This was a horse with both left hind limb lameness and hind limb ataxia. Watch this horse as the rider goes to decelerate from trot to walk. The horse has its ears back, its mouth open, braces the neck against the rider's hands. Got an audible left hind limb toe drag. And as the horse starts to decelerate, we see that the rhythm becomes more irregular and the horse has a shortened cranial phase of the step of the lame left hind limb. We also see alterations in body posture and balance in association with hind limb lameness, particularly when hind limb lameness is bilateral, which it frequently is. Look at the posture of this horse in canter, both on the lunge and ridden. The horse is very stiff and on the forehand and croup high. This horse had bilateral hind limb proximal suspensory desmopathy and sacroiliac joint region pain. Whenever we're looking at horses, I think we have to look at the overall quality of the gait, the stride length, animation, impulsion, and suspension or lift in hand on the lunge and ridden. And we have to ask the question, what's expected for the type of horse and its level of training? This horse moves closely behind with a large pelvic exertion, but I am unable to detect any overt lameness. On the lunge, the inside hind limb crosses under the feet, and there is reduced range of motion of the thoracolumbar-sacral region, and not much swing of the tail. The speed is somewhat erratic. Going to the right, the horse is more unbalanced, and the right hind limb crosses more underneath the trunk and hindquarters swing out. However, as soon as this horse is ridden, we see a more obvious lameness. Now the horse is showing a right hind limb lameness. There's a bilateral hind limb toe drag. The rhythm is somewhat irregular. Now a rider has changed direction. She changed the diagonal on which she was sitting, and left hind limb lameness predominates. So I would grade that as a grade 2 out of 8 left hind limb lameness. She changed diagonal, and the lameness of the left hind limb reduced immediately. Horses are generally lamer when the rider sits on the diagonal of the lame limb. Lameness may be accentuated when the horse is describing small circles, particularly with the affected limb on the inside of the circle. Bear in mind, whichever grade I assign to the lameness observed in each hind limb, it may not accurately reflect the degree of discomfort the horse is experiencing if it is bilaterally lame.